Welcome back to Real Talk About Feminism. We are currently sitting here in the studio, freezing. It's a chilly day.
Freezing. Why was it so cold today?
We're under a winter storm
I
watch.
know, but I was like,
Yeah.
okay, so this morning when I was driving to work, it started snowing.
Mhm.
And then I got to the office and there was nothing.
Mm.
And then when I left, there was nothing. But it kept saying, like, Friday by 5, it's going to
Yeah.
dump. It's going to start dumping.
Yeah.
And so I'm just waiting for it. But I'm not excited.
Yeah, I don't really know because, like, it was actually snowing over here for, like, a good amount of the day, but just a little bit, and then it all melted off.
That's so weird.
Yeah, I'm like, I don't really know, but, like, I don't know. Regardless, it is absolutely freezing.
It's so cold.
Yeah.
After being in Arizona a couple weeks ago,
Mhm.
I have been dying for
I know.
desert weather, the heat, the warmth. And
I
it wasn't
know.
even like that much warmer.
It wasn't. Like, it was cold over there for them.
Yeah, but at least there wasn't snow on the ground.
We
There
could
wasn't that, like,
feel
bite
the
in the air.
sunshine. Yeah, like, I went out in a tank top one day.
Same. Yep, that was so
Like,
nice.
It was nice. So, yeah. It is cold, but we're ready for today's episode. We are talking about the Black maternal health crisis.
Yes.
So, it's an important topic.
It's very important. I'm really excited, and I think this episode is going to be really informational. So, let's get into our obsessions first. My obsession goes hand in hand with what we were just talking about. I am obsessed with desert landscape right now. Driving through Tucson and seeing, like, all the saguaro cacti and all the cactus, like, I was obsessed with that.
Yeah. I know. It is really pretty. Like, it's a very different type of pretty, like, way different than Colorado. But yeah, I really liked it. The one thing I didn't like was, like, the lack of grass.
I know.
But I
It's all
loved the
dirt.
cactuses and, like, just, like, the types of plants. It was cool.
Yeah.
Not like I've never seen that before. I've been to Arizona multiple times, but I don't know, like, it's just fresh in my mind.
Yeah.
Yeah. Well, my obsession is this game on my phone called Township. I am obsessed with this.
Every time you're on your phone now, you're playing Township.
Well, yeah, because I have to, like, harvest things and, like, you know, there's times and stuff. But no, so I never have games on my phone, but our youngest sibling was like, you should download this game. So I was like, whatever. I was like, I'll play it one night. I'll probably delete it. Like, I don't need a phone game. But it's kind of nice because, like, you get to be creative and, like, you're basically building a town.
Yeah.
And, like, keeping it up. So, like, you're harvesting crops and you're putting them in the factory to make different things and, like, fulfilling orders for all the town people. Like, it's just so fun. So if anyone's looking for a little interactive, like, phone game, look up Township and then message me on Instagram and so that we can connect and be neighborhood friends.
Towns.
Yeah. But
it's
fun. I like it. So that's my obsession.
That's so funny.
Yeah.
I also don't really have phone games, but there are 3 that I have that when I'm watching movies at night or something, I'll just, like, rotate between.
Yeah.
But I love my coloring app. Like, I love to just color on my phone.
Yeah, you do color on your phone a lot.
I love coloring on my phone. It's, like, literally part of my wind down routine.
Yeah. I know at night you're like
just tapping.
Yeah, so that's my obsession.
Okay. Well, today's feminist highlight is Mar Galceran. She's a European political figure and she has Down syndrome. She has been engaged in politics since she was 18 years old, and in May of 2023, I almost said this year, she was elected on the People's Party's candidate list for the regional elections in Valencia, Spain, and she earned a seat in the Cortes Valencianas, which is the parliament that represents that region. She is dedicated to dismantling barriers for individuals with disabilities.
Oh, good for her.
Yeah, she's the first one.
That's awesome.
And I think that's really great because we need, when we talk about representation, I think a lot of times we forget including those with disabilities, but it's a very large group and I think they're left out often. So I like to see that.
Well, that's awesome. Thank you for sharing. Do you have any, like, life updates or anything going on?
I am really proud of myself because I have almost saved up enough to fix my car.
Yay!
And I got paid today. And so I moved my lump sum into my savings account and I was looking at it and I was like, I am really proud of myself because I've been
Nice.
working really hard to like get my budget down, do my money dates just like Laura taught us.
Yes.
And it's been going super well.
That's awesome.
Yeah.
It's a really good feeling to like after like financial stress and like
Yeah.
instability,
Literally.
like finally building your savings back up and like working towards your goals.
Yep.
So.
Literally, I was thinking today when I checked my bank account, I was like, I remember looking at a negative balance sometimes, and I am not even like close to there anymore. And so it's a good feeling.
That's good. That's
Yeah.
awesome. Good job.
Thank you.
I mean, speaking of savings, I got paid today also. And so I was moving around my money.
Yep.
And I officially have a few $1,000s saved for my Paris trip.
Yay.
So that's really exciting.
That
I'm
is so
over halfway
exciting.
there to like my goal. So
I'm obsessed with that.
I know. I was like, okay, that's
Oh my
cool.
gosh.
Yeah. So
Oh, that's so fun.
yeah.
I have something else that I haven't seen you since last night because I slept at Cleo's.
Oh, yeah?
But last night it was so funny because I asked him, we had a movie on, but then it was one of those nights where we were like talking the whole night instead of watching. And I love those nights. But I had asked him, like, when did you delete Hinge?
Oh.
And I don't know if you've ever had that conversation with Kendrick.
But I think he deleted it the first week that we knew each other. But we were like, I moved across the country with him.
Yeah,
so
literally. Okay, yeah.
Okay, what was his answer?
Your guys' was like very unique. But we kind of went like back and forth. Like we were like going over the timeline of our entire relationship. And we came to the conclusion that he had deleted it. So we met end of March. And we started officially dating like beginning of May. And he was like, I think I officially deleted it like beginning to mid-April. And I was like, oh. But then I was thinking, I was like, well, I deleted it 3 weeks after. And he was like, I wasn't on it. Like, he was like, I was looking at who liked me. And I was like, same. I was like, that's the most addicting part is like seeing who liked you.
Yeah.
And it was just a funny conversation because it, you know, when you're like reminiscing. And
Yeah. No, so that is funny.
But then I told him, he was like, 3 weeks? Wow. I was like, I manifested that shit. Like, me and you, I manifested that.
Yeah, you did.
Kind of unintentionally, but I literally said, trust the universe. And look where the universe has taken me.
Look at you.
So, manifestation update.
That's really exciting. Yeah, I like conversations like that.
I know. It's just so fun. Like when you have that relationship where like you just can just talk.
Yeah. Yeah, I love that. Okay, one more update from me. So right today is like an anniversary of mine and Kendrick's. And it's our 8-month anniversary. But
it is.
Yeah, but tell me why I literally woke up this morning and I was like, happy anniversary, parentheses, can't remember if it's 9 or 10. And then like I was like, you know, love you, whatever. And then he didn't feel good, so he was like sleeping in. So then it was like 30 minutes later, I was like, I really don't know if it's 9 or 10. And then he replies when he wakes up and he was like 8. And I was 8? Like, oh, yeah.
Oh.
I was like way off. I was like, oopsies. Oops. Like it just feels like so much longer.
It does, yeah.
But yeah, like I try and remember like how many months you have been at, but I was like, I'm pretty sure they're at 10. That's why I thought we were at 9.
Oh, I thought you were saying the day.
No.
Okay, yeah.
Yeah, so I don't know where my head was there, but I was not remembering our dates at all. And I was like, oops.
Yeah, honestly, come to think of it, I totally like breezed by our date.
Yeah.
Ours is the 7th and I completely forgot.
Yeah.
But I'm like, now it's not.
Yeah, it's not like it's like
you go to 6 months, that's the milestone. And then after that, you're like, we'll just get to a
year.
Yeah,
like,
you know,
we'll get to a year. I know, that's why I was like, I don't really remember because yeah, it's like 6 months. That's like the big one.
Yep.
And then a year. Like you don't think about it. And also like it's fun to like acknowledge more since we're long distance. And so it's like, but yeah, I was like, I butchered that. Sorry.
Oops.
Yeah. Anyways, last update from me. Should we get into the episode?
Yes. Okay. So I am excited about today's episode because I came across this topic idea. I was scrolling on Instagram and I follow CNN, and there was this story that was being done by one of their anchors. Her name is Abby Phillip. And she was doing an interview with Anderson Cooper about her experience of deciding to have a home birth over a birth in the hospital. And I am going to be pulling clips from a podcast interview that she did on the podcast called The Assignment with Audie Cornish. And they talk about Abby's experience as well as the overall Black maternal health crisis that we have been seeing and are seeing in the United States. She said, quote, "A year or two after my first child was born, the CDC released a report showing that Black women were 3 times more likely than white women to die of pregnancy-related causes. And it made me nervous about being pregnant again, about being in a hospital, pregnant again. And then the second time was around the spring of 2020. So that was from the host of the podcast, Audie. And I really liked their conversation because they are both Black women who have been pregnant. Audie has 2 children and Abby Phillip has 1.
Okay.
And so they were sharing their experiences and relating to each other. Before we hear more about Abby's experience and many other Black women's experience in this country during pregnancy and childbirth, I did some research on the statistic of Black women being 3 times more likely than white women to die during childbirth or from pregnancy related
Oh
causes.
my gosh.
It feels outrageous, right? I'm like, we
Yeah.
are in 2024.
Well, I'm thinking, I feel like, I mean, obviously some complications are, you can't get past them, but like, I don't think many women are dying like in childbirth related to 50 years ago.
Yeah,
So like for it to be 3 times more for Black women, that's a lot.
it's a lot.
Yeah.
Yeah. I found an article from the NIH that backed up the statistic, and then I really started to dive into the issue. And there was this quote from the article that I'm going to share. Quote, "While predisposition to underlying health conditions such as hypertension, cardiovascular disease, diabetes, and obesity plays a role in racial disparities in pregnancy-related deaths and other adverse pregnancy outcomes, when these medical conditions are not present, racial disparities still persist."
Okay.
Which is true. We know that different races and different demographics have different underlying health conditions, different health makeups. Like, we know that for a fact.
Mhm.
But it's saying that even with all those present, the statistics should not be that high.
Yeah.
This is an institutional issue. And in this article, they included a really helpful visual that I'm going to share on Instagram when this episode is released. But I'm going to verbally talk it out to provide some background into the structural and institutional disparities
Okay.
that are going back like hundreds of years.
Mhm.
So it has 3 bubbles, and in the first top bubble, it has structural determinants of health. And below it, these are the things that are listed: slavery, structural racism, institutional policies and practices, Jim Crow, GI Bill, redlining, mass incarceration, and the 13th Amendment.
Okay.
So these are things that structurally there are racial disparities.
Mhm.
Then there's a bubble that is connected to the top one by an arrow and a plus sign. And that one lists social determinants of maternal and infant mortality. For those who don't know, that means deaths. Mortality is death. And listed under that is food stability, education, income, neighborhood demographics, built environment, safety, housing, access to care, rates of incarceration. And then there's an arrow leading to a bubble that says increased maternal and infant mortality. So it's clearly illustrating that the structural and the social determinants of health, based on the racial disparities, lead to the higher mortality rates.
Okay. That makes sense.
Yes. So it backs up that statistic
Mhm.
as to why it's so high. I am going to start sharing more of Abby's experience, and I'm going to play the first clip from the podcast interview.
I'm excited to hear it.
It's really good.
Yeah.
I had my first child in 2021, and it was a strange experience for me because I went from personally being the type of person who was like, you must have a baby in the hospital with all the medicine and all the things, to having a home birth, which was totally unexpected for me. I cannot emphasize enough how much I was not a home birth person when I first started out.
What did you
And
think a home birth person was?
I just thought a home birth person was somebody who didn't believe in modern medicine and, or was kind of just sort of hippie like, and I just didn't think of myself in that way. I really believe in
I
modern
don't think of you
medicine.
in that way either.
But a lot of things happened when I was pregnant that made me realize that a lot of women like me, women in their maybe late 20s, early 30s, young professional Black women, were choosing to have out of hospital births.
Interesting.
It's very interesting. And we're going to get more into why that is
Mhm.
and her experience, like being at the hospital and the doctor.
Mhm.
I am now going to play the second clip.
I had my child before a lot of the big reporting on this, right?
Yeah.
I had one in 2017 and then one during the pandemic. And you're right, the difference in tone and tenor of that of that pregnancy chatter
Yeah.
was significant. So much reporting started to come out about maternal health statistics in America, that overall they were worse than other countries, and that the gap for Black women was really large.
Yes. And COVID didn't help. COVID was a time when it actually was kind of dangerous to be in a hospital.
It was.
It was.
I cannot imagine
I
how
know.
fearful I would be, like being pregnant during COVID.
I know.
Do you ever just sit and think about the fact the pandemic happened?
Sometimes, not very often, but I recently did have a moment where I was like, someone said like 20, like in COVID, and then they were like in 2020, and I was like, it's 2024.
Yeah. I'm like, how was it 4 years ago?
Like literally 4 years ago, it was like breaking out right now.
Yeah.
That's
It was
crazy.
crazy.
But yeah, no, that is true. Like COVID didn't help those numbers, but yeah, like a lot of people are going to be fearful of
Yeah.
the hospital during that time.
Yeah. So if you couldn't differentiate between the two voices, both of them were talking at different points, the host and Abby, and they were both relating to their experiences. The host had a baby during the pandemic, and Abby was pregnant during the pandemic. So they were sharing their experiences with that and being able to relate on the level of both being Black women in that situation.
Yeah.
Abby shared in detail how she felt super uneasy and nervous about being pregnant during the pandemic, which is valid.
Yeah, totally understandable.
She also wrote a CNN article sharing her story. So she has this podcast interview. She has her CNN story that she wrote, which I'll link both in the show notes. And she said, quote, "It was a scary time to be pregnant or anywhere near a hospital. Layered on top of all that was my fear that I would not make it out of childbirth alive. I can't tell you exactly when this became such a deep-seated fear for me, but my anxiety would ratchet up dramatically at the thought of being in a hospital, unable to advocate for myself. That fear was compounded early on in my pregnancy when I was ignored and dismissed by my doctor's office. So much so that I left that practice and went searching for better care." I think all women to some degree can relate to that, feeling like shot down. No matter what I say, they're not going to believe me. I'm in so much pain, but nobody cares.
Yeah.
So I can't imagine how scary that would be being pregnant. And you're like, I'm worried for myself, but I'm also worried for my unborn baby.
Right.
Because I want a healthy pregnancy.
Right. Like there's so many factors for these people talking right now working against them. Like, oh, that is so scary.
Yeah. Even after she went to another practice, though, she felt that the 30-minute visits were super isolating. And she mentioned asking for more time, and she just felt rushed always. Like the visits were just like in and out. How are you? Okay, cool. Any concerns? She couldn't feel like she could advocate for herself. She said, quote, "But I would realize later as a first-time mother, I often didn't know what I didn't know. I hesitated to bring up my experiences and discomfort, unsure whether they were worth mentioning or indicative of more serious problems."
Mm. I think that is also relatable.
Absolutely. Because you're like, am I being paranoid?
Mhm.
Am I reading into it?
Yeah. And if you already don't feel like you're being, like, fully paid attention to or, like, fully cared for, then you're not gonna bring up those things because then you're
Right.
like, "Okay, well, what if it is something?" But I'm more thinking, "What if it isn't something and I just come off stupid?"
Yeah.
So, like, of course you're not gonna bring it up.
Right. Which should not even be a thing. Right. Like if you're concerned, you should bring it up.
Yeah.
Okay. I'm going to play another clip from Abby.
And I realized that as soon as I got pregnant, I started talking to other Black women who had had children or were in a similar situation. Then there's really a sense that all of us are trying to kind of stay alive.
Yeah, really beat the odds, right? It's basically a whole dialogue to beat the odds.
Yeah. And the weird thing was that I didn't think much of it until I started to talk to non-Black people, women, about it, and realized that a lot of other women who are not Black don't necessarily have the same situation. And that dichotomy of experiences was surprising to me because I thought everybody experienced pregnancy like I did, where I felt vulnerable.
Running defense.
Yeah.
I wanted to pull in the clips for this episode because I wanted to hear from Abby herself, her experience, because I've never been pregnant and I'm not Black, so I can't speak on this. And I think it's a really important topic.
Yeah, I think she has some very good insights, and I think unless you, like, step back and think about things sometimes, you don't realize that that's not everyone's experience. You don't realize it's only happening to you or a specific group of people. And so, yeah, I think that she is, like, can be super relatable to women, and I appreciate her, like, speaking out about this.
So she ended up talking to many women, as she mentioned in that clip. And she decided, I am tired of not being heard and not being validated. And she wanted to take her health and her pregnancy into her own hands. And so she felt that a home birth was the right choice for her.
So as a result, you end up really diving into the world of midwives and specifically the resurgence in home births and midwives within the Black community, which is actually, in thinking about it, very similar to what we reported on a few months back about the surge in homeschooling. Yeah. And it feels like part of this broader movement of like certain communities saying, hey, if the institutions don't work for us, we're going to work for ourselves.
Yeah.
I thought that was a really good quote.
Yeah.
Like, we're just going to take it into our own hands because nobody's seeming to help us here with this, and it's important.
Yeah.
So then they start to discuss the data of midwifery. And in 1980, 1.1% of births had a midwife attend. By 2020, it was 12%.
Oh, wow.
And if you specifically look at the number of home births among Black women, they increased to 36% just from 2019 to 2020. That's a big jump.
Oh, yeah.
Yeah. So that's part of the reason Abby's speaking on this, is because she's like, obviously, it's not just me. Like,
Yeah.
we as Black women are feeling this way. And so we're taking it into our own hands and we're making a choice that feels right for us.
Yeah. That's really crazy, that jump, because that's only a year difference.
Yeah. A year difference, and it jumped that much.
Yeah.
From 2020 to 2021, they increased another 21%. So something is definitely happening here where Black women in particular are choosing to leave the hospital system, finding that it's not necessarily safer to be in a hospital to give birth, and looking for alternatives.
In the CNN article, Abby talked about how her entire birthing experience went very well. She definitely felt like she made the right choice for her. She ended up hiring a midwife who came to her home, took time with her appointments, made Abby feel genuinely heard, and asked questions about every aspect of her life, like her stress levels, her water intake, her physical activity. She said, quote, "I realized quickly that she wasn't just checking that my baby's heartbeat was still present. Her job was to ensure that I stayed on a path to a healthy pregnancy. I felt seen, heard, and more empowered. Eventually, my fear began to subside. It was replaced by excitement and joy for the arrival of my daughter, emotions that I had struggled to access earlier because of how worried I had been about surviving pregnancy and childbirth." That's got to be a really great feeling where you're like, I can actually enjoy and like look forward to her coming.
Yeah. Yeah, I like the more holistic approach too, like,
Definitely.
because regardless of, like, who you are, I think in general, in the doctor's office, a lot of times it is just in and out because that's the healthcare system, and so, yeah, you don't always feel like you're heard or seen, and so even just having someone take time to see how your general life is going because, like, stress levels, like, everything like that affects pregnancy, and so to have someone sit down and be like, "How are you doing? Like, what are you concerned about? Let's figure out if we need to be drinking more water or what type of food you need to be eating." Like, that is more helpful and than just, like, a doctor coming in and, like she said, checking your baby's heartbeat and then leaving.
Yeah. Like, I think she felt that, I mean, she said that, like, it wasn't just about the baby, it was also about her.
Right.
And I think people forget that.
Yeah, like, yes, the baby is important, but if the mother doesn't survive or if the mother isn't healthy, the baby's not gonna be healthy.
Yeah. She said that while her labor was painful, of course, she was able to move around freely. There weren't beeping monitors or strangers coming in and out of the room. She could eat and drink freely and wasn't being told when to push and how often. She said, quote, "Small comforts denied to many women in a hospital setting."
Mm,
She then said that her people and her team surrounding her, they were all focused intently on helping me and my body do what it knows how to do on my terms and at my pace. And I was like, dang, our bodies do know what to do.
Yeah.
It's a natural thing.
Mhm.
So to wrap up, I want to share this quote she said. "By the end of my journey, I was a different person than the woman who had that first nervous meeting with her midwife just a few weeks earlier. I realized that the core of the midwifery model of care is that I am not a passive actor in my health, but an active participant. I learned how to listen to my body."
I really like the way she said that. It's this whole thing is, like, reminding me of a conversation that I recently had, with someone that I work with. He is getting ready to go on paternity leave, and so, we were just, like, as a team, we were just talking about stuff, and someone asked if his wife was gonna be having, like, a home birth or going to the hospital, and so he was telling us that this is their second kid. Their first kid, they had no idea what to do. They didn't feel, like, prepared with knowing when to go to the hospital. And so they went. Well, like, she was in labor. She went once, and then they were like, "Oh, it's too early, go home." So they sent her back home. And then she went again. They said it was too early. And then I think it was the third time they went and they got there and she basically was like in and out in 10 minutes, but like she didn't get an epidural, like nothing because they were like, it's too late. And I was like listening to that and I was like, I don't think I don't think they would have done that for a man.
Oh, absolutely
Because
not.
and, like, how unfair is it for her to, like, be in active labor? And I get that late active labor can go on for hours and hours and hours, but, like, she was trying to, like, do the best she could and time it, but every time she was told no until it was the last possible second, and I was just like, "That is like, that's not a good system." Like, for women, for her to not get an epidural and she wanted one, but there wasn't enough time, but she had been there earlier. And so, like, it's just giving, like, women's choices being made for them And it's just reminding me of like, oh, anyways, to wrap it up, with their second kid, they're having a home birth.
Oh,
And
nice.
he said, he was like, she's really excited to be able to sleep in her own bed,
Mm-hmm.
to move around. And so, yeah, like obviously it's a huge issue, and especially more for Black women, as we're hearing the statistics, but like for women in general, like they just, the feeling of being in a hospital just isn't the best sometimes. It might work for some people, but like, I don't know.
It doesn't feel super comfortable.
No, not at all. And like, you don't get to do things on your own terms.
Yeah, at
So,
all.
Yeah.
I know this whole thing, I'm really happy for them.
Yeah.
This whole thing, going back to that, I'm happy for them that she chose that for herself.
Yeah, I know. And when I heard that too, I was like, oh, we're about to do this episode.
Yeah.
And this is like me learning for the first time. But yeah, I was just like, something isn't right about that. Like, that's what I was thinking. I was like, she went multiple
And that happens
times.
all the time.
Yes,
all
like
the
that
time.
does happen all the time. But I was just like,
this
not
whole
right.
thing made me think I definitely want like a water birth in like one of those
Same.
water birthing facilities where it's like dim lights and serene music playing and you're like able to be in any position you want, not on your back, which is, we all know, is not good.
No.
That was invented by men.
Yeah, literally.
So to wrap up, there are so many changes that need to be made to our healthcare system. We all know that. I took several classes in my undergrad, which was in healthcare management. I took several classes on like racial disparities in healthcare and like socioeconomic disparities. And it is very evident that there is a Black maternal health crisis. And as we mentioned, the statistics in the beginning, that proves it. There's so much research to back that up. But I want to share this quote from another NIH article that I found. And they said, it argues that communities of opportunity should be developed to minimize some of the adverse impacts of systemic racism. These are communities that provide early childhood development resources, implement policies to reduce childhood poverty, provide work and income support opportunities for adults, and ensure healthy housing and neighborhood conditions. The healthcare system needs new emphases on ensuring access to high-quality care for all, strengthening preventive healthcare approaches, addressing patients' social needs as part of healthcare delivery, and diversifying the healthcare workforce to more closely reflect the demographic composition of the patient population. So they laid out so many solutions that would solve so many problems, maybe not solve, but improve our system for everybody. So that there isn't 3 times that statistic of 3 times Black women being more likely to die in childbirth. Or from pregnancy related causes. So I thought that was a really great way to wrap up. And if you are in healthcare, maybe you want to look into that. And like, I definitely would love to be somebody who could help implement some of this stuff in the future. So it's really important. And I loved being able to have Abby's voice that I could play in this episode. Like I mentioned, I will put her article and this podcast interview in the show notes so you guys can look into it more.
Well, thank you. I also loved hearing Abby and hearing her story, because we're talking about her story and many other Black women. And so, yeah, I like that we were able to hear her voice. And yeah, I'm going to go check out the whole podcast episode because it sounded like a really great listen.
It was really great. And for all of us girlies, let's advocate for ourselves when we are at the doctor. Even if it's scary, you are the one that's paying for these services.
Right.
And if you don't like the provider and you don't feel heard, keep switching until you find one that you like.
Yeah, no one should make you feel not heard. Like, you're the only one in charge of your own healthcare, unless you physically can't make those decisions. But like, you're in charge of you, so you should feel comfortable. And I think too often people just go about just, being quiet and not saying anything to not be a burden or to not be dramatic. That's what it is.
That's a good point. Yeah, we're so nice and like, oh, it's okay. I'm okay.
Yeah, they seem rushed. It's fine.
Exactly.
I'll see if it keeps going for the next few months. Like, yeah, no, we don't need to be doing that. Just take care of yourself. And if your providers aren't taking care of you, then like Ken said, it's time to move on.
Find someone who will. Well, thank you guys for joining us for another episode. As always, all of our links to our socials and ways to connect with us are in the show notes. That includes our book club sign up, join the discussion forum, and our weekly email newsletter sign up. So be sure to connect with us, and we'll be back next week.
Bye.
Bye.